Hello, it's nearly 11 a.m. here in Seoul. I'm Oh Soo-young at the Arirang News Center. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the coronavirus outbreak here in the nation. In just a few moments, we'll cut into the briefing at the Sejong Government Complex with simultaneous interpretation available for you in English. Director of Health Policy Yoon Tae-ho will be briefing us on the coronavirus situation here in South Korea, filling us in on the number of new infection cases seen as of midnight and what kind of efforts the government is making to contain the virus, especially with the recent spurt of cluster infection cases in the capital area of Seoul, as well as the surrounding Gyeonggi-do provinces. We've seen the numbers growing and topping 300 as of late, so there have been many concerns surrounding what many are seeing as the second wave of COVID-19 infections here in the nation. And of course, authorities are doing their level best to contain these additional cases by introducing stronger prevention measures and introducing the second level of social distancing. Well, Director General has taken to the podium and it looks like the briefing is about to begin.
8월 27일 목요일 정례
Let us now
브리핑을
begin our regular
시작하겠습니다.
briefing for August 27th,
오늘 0시 기준
Thursday.
국내
As of today
발생한
midnight,
신규 환자는
we have a total of
434명입니다.
434 new local
이중
infections.
수도권의 신규
Among
환자는
them, those in the metropolitan area
313명으로
amount to
국내 환자 수의
313,
약 72%를
about
차지했습니다.
72% of the
또한
local infections that have occurred
강원,
today.
전남을
And in
비롯하여
Chungnam, Gangwon,
광주,
and
대구
Jeonnam,
등에서도
in Daegu,
환자가
Gwangju
증가하면서
as well, we see a
수도권 외
cluster
지역에
infections
환자 발생이
taking
이번
place,
달 처음으로
and we also
100명을
have
넘었습니다.
seen the first case of
수도권과
over
그 외 각
100
지역으로
cases in
확산된 감염
non-metropolitan
전파가
areas
다양한
this month.
시설과 모임
And
등을
the
매개로
clusters infections that have
연쇄적인
been taking
집단
place in the
감염을
metropolitan
일으키며
area
더욱
are
크게
also
확산되는
increasing
양상입니다.
through chains of transmissions into other
8월
regions
16일
as well.
수도권 거리두기 2단계
And
조치
as
이후
for the level
지난
2
주말에 수도권
social
이동량을
distancing for the
분석한 결과
metropolitan area
그
starting from
직전 주말에
August
비하여
16th,
약
we have seen
17%
that there
감소한
has been
것으로
about
나타났습니다.
17% decrease in
이는
foot
지난 2월
traffic compared to the
대구
previous
경북
week.
당시 나타난
And
약
compared
40%의
to about
이동량 감소에
40%
비하여
decrease of foot
일반에
traffic
못 미치는
in Daegu
수준으로
and Gyeongbuk province
지금의
during the
확산세를
largest outbreak,
진정시키기에는
they
아직
also fall short
부족합니다.
of that number, and we believe that they
전
are
국민이
insufficient.
강력한 사회적 거리두기를
And
통해
the
그간의
entire
집단
public
감염
needs to
확산의
continue
위기를
to carry
극복했던
out social
경험을
distancing
기억하며
measures,
당분간
and we need to remember
예출광고는
what we did during the
약속은
first
하지
outbreak
말아주시기
that
바랍니다.
centered around Daegu and Gyeongbuk region, and we need to
사랑
refrain
제일
from having
교회와 8.15
social
서울
outings.
도심
And
집회와
in relation
관련하여
to the Sarang Jeil
신속
Church
검사 대상
and
관리
the
방안에
Liberation
대해
Day Seoul rally,
말씀드리겠습니다.
we are also exerting our full efforts
먼저
to
사랑
conduct
제일
contact
교회와
tracing and
관련하여
testing.
이미
In relation to the
서울시를
Sarang
통해
Jeil Church,
4,000여 명의
we have
신도와
tested
방문자 명단을
we have
확보하였고
secured the list of
추가적인
4,000
정보를
worshippers
통해
through the
현장
church and also
역학조사를
through the
실시하여
local government of
교인,
Seoul City.
방문자
And we
명부,
have also conducted
숙직자
our
명부,
independent
교인,
investigations,
교족부,
and we have
등록
also
카드 등의 원본을
gathered
확보하였습니다.
the original list of
이
all of
자료들을
the worshippers who are
바탕으로
registered at the
최종적으로
church.
5,900여
And based on
명을
this
관리
data,
대상으로
we have
분류하고
designated and categorized
그
about
명단을
5,900 people as
지자체로
those
선보였습니다.
under the need to have
8.15
specific
서울 도심 집회와
inspections, and they have been
통신
handed
3사
over
기지국 정보를
to
통해
the
광화문
jurisdiction
인근 체류자
local
명단을
authorities.
확보하는
And as
한편
for the Liberation Day rally, we have secured the list of the attendees through the mobile traffic through the mobile carriers, and we are also working with the local bus
광화문
rental
인근 체류자에
companies
대해서는
to check
지난 20일
and to have the list
진당
of
검사를
those who
받도록
attended
문자로
the
안내하였고
rallies through these
이들과
rented
버스
buses.
탑승자
And we
명단을
also
통합하여
continuously
중복 인원을
to look
제외한
at
약
this
5만
list,
1,000여
and
명을
we also
관리
have
대상자로
found
분류하고
about
지난
51,000 people that have been categorized under this list
해당
to go
집회에서의
under
집단
specific
감염이
inspections.
광주, 인천
And
등
these
교회에서의 집단
cluster
감염으로
infections
이어져
are now
전국으로
spreading to
확산되고
other
있으며
regions, including
최근
Gwangju
이러한
region
사례가
as well.
계속
And we are
발견되고 있습니다.
continuously to
추가적인
witness
전파를
such
최소화하기
chains
위해
of
집회에
transmissions.
참석한
In order
분들
to minimize the further
신속하게
transmissions, we ask
진단
all
검사를
of the attendees
받아주시기
to the
바랍니다.
Liberation Rally to get tested
관리
as soon
대상으로
as
분류된
possible.
분들에 대해서는
And as for the people who are subject for those strict monitoring, the local governments are exerting their full efforts to test every one of them, and they are also inspecting and looking at the list of the people with whose whereabouts are unknown. And we will take stern measures in cooperation with the police department, and we will also be based with legal principles, and we have stern measures against those who breach these quarantine measures. And regarding the collective walkout of the medical practitioners, we have a few words. Amid a very serious crisis of a sporadic outbreak of the COVID-19 cases throughout the nation, the collective action of the medical practitioners are also carrying out. And the government is also taking stern measures against such collective actions. And as for yesterday, 8 a.m., we issued the resumption to work order to all of the interns, residents, and fellow doctors in the metropolitan area. We are also conducting our close investigation into these hospitals. And we have done an investigation about 20 hospitals, and in their ER as well as surgery rooms, we have issued the resumption of work order to about 358 intern doctors and resident doctors as well. And we will be going back to these hospitals, and we will make sure that they return to their duties. If they do not do so, we will be taking stern measures. And the stern measures include 3 years or less of sentence in prison, and also about 30 million in penalty. And going forward, we will make sure that we will prioritize the safety and lives of the public, and we will make sure that these resumption to work order will be expanded going forward if the doctors continue to take collective actions. And lately, as we see a spread of the COVID-19 cases stemming from the metropolitan area to non-metropolitan areas, we are also exerting our full efforts to extend such an order to other regions of the nation as well. So once again, we urge all the doctors to return to their duties and to protect the lives and safety of the citizens. And as for neighborhood clinics, when the amount of their closure amount to about 10%, we see that there is a high risk of a medical collapse for the citizens living in those areas. So we will be reviewing the issuance of such an order. And as of yesterday, about 1 out of every 10 neighborhood clinics have been going on closure. So we believe that there is not an immediate crisis as of now. And we ask you to continuously to ask for your considerations going forward, and please resume back to your medical duties. As of now, in 4 metropolitan areas and metropolitan cities, we have issued the resumption of work order. However, we will be also looking at these situations unfolding, especially with the typhoon hitting the country today. And we believe that these collective actions are deemed as to be an infringement of the collective duties that the doctors need to exert, and that we have accused the Korean Medical Association to the Fair Trade Organization, and we believe that we are going to be based on the legal principles and legislations, and if there are breaches of such a measure, they will be facing about 2 years in prison as well as a penalty as well. And ahead of the qualifying examinations of the medical services, we ask the medical students as well, in order to testify and justify the testings, if you need to also think about and reconsider whether you will be canceling from the examinations. The examination will be carried out as scheduled, and if you do not reply to our phone call or SMS, we will be nullify your test applications, and you will get refunded of the test cost. And we ask for your intentions to be expressed as soon as possible. And yesterday we had a rumor a rumor and a false news, a fake news that police officers raided the Severance Hospital, and many of the residents and interns had to flee the hospitals. However, this is just fake news, and there were also many fake news about that the public doctors will be administered and appointed through the pick of the civil organizations. And to these many false news and fake news, the government will also take stern measures, and we ask the members of the public to also become rational when they face such fake news going forward. And as for the collective action of the medical practitioners, many of the patients utilizing the ER as well as surgery rooms and the ICUs are going through very damages. If these services are left vacant, we need to really think about what the meaning of this is. You need to come back to your duties to treat many people who are facing emergency situations, and please do not ignore the voices of many patients who need to go through emergency surgeries, like those who are battling against cancer and so forth. So we ask the health practitioners to come back to their duties as soon as possible. The Typhoon Bobby has hit the Korean Peninsula, and many regions here in the country have hit by the typhoon, leaving great damages. We provide you with words of comfort, and we also provide the temporary shelters for evacuation. And when you are at these enclosed spaces and when you are working for the recovery work, we ask you to keep your masks on at all times and also abide by other quarantine measures. It is very important that we reduce the number of gatherings, and if you have any gatherings or meetings planned, please cancel them and postpone them. And if you are heading outdoors, please check if your travel is essential. And the government is also exerting our full efforts to review all of the possibilities available, including elevating the social distancing to level 3. We have a very strong and valuable experience of collaboration and cooperation in combating the virus, and we ask for your cooperation going forward. Thank you very much.
질의응답 시간을 가지겠습니다. 배석자분들은 단상 위로 올라와 주시기 바랍니다.
That was a government briefing we just heard with Director General of Health Policy Yoon Tae-oh telling us about the additional infection cases here in the country. We just heard that there were 441 infection cases seen as of midnight, bringing the accumulated total to 18,706. There was unfortunately one additional death, bringing the total death toll to 313. That wraps up our coverage of this morning's briefing. We will be back though with our regular newscast at noon Korea time. Bye for now.